Welcome to the Discovery Doc podcast, where we advocate for optimal wellness and reducing everyday toxic loads, no matter where life takes you. I'm Dr. Cece, doctor in nursing practice, self-proclaimed toxin tamer, and a crunchy mama.
I'm Anna Kate, a medical mystery overachiever and your discovery liaison. Join us on this exciting journey as we explore the world of holistic health, cutting-edge research, and practical solutions for a healthier life. Together, we'll navigate through the complexities of wellness, sharing valuable insights and expert advice.
Tune in to the Discovery Doc podcast. Get ready to be inspired, empowered, and discover a whole new way of looking at your health.
Welcome back to the Discovery Doc podcast. I'm here with your host,
Dr. Cece, functional medicine nurse practitioner, self-proclaimed toxin tamer, and crunchy mama, and our co-host.
I'm Anna Kate, your medical mystery overachiever and discovery liaison. And we are in a new place. We are on a different couch today. So it may look and sound slightly different today. So we're making it happen because life happens.
Life happens. Yeah. So we are here doing our thing when we can, where we can, to make sure that we continue to produce content for y'all. But yeah, it just looks a little bit different today.
Yep.
But continuing down kind of this whole month is about mental health. And so one thing that I really wanted to highlight is with the holidays, that also doesn't look the same for a lot of people. For some of us, the holidays are this like bright, cheery, eventful, lively time in our life. And for other people, it's the opposite, or it's a time filled with anxiety or just exacerbating certain things that we feel throughout the year, where we feel heightened anxiety or heightened depression or loneliness or sadness. And I think that is really important to highlight and to remember, and to be a source of support for people that we might have in our lives that are going through that. But then also to give some quick little tips as to what we can do to maybe prevent that.
Yep.
Because in all reality, 38% of Americans say that their stress increases during the holiday season. And that then leads to those symptoms that we kind of just talked about, but it might be because of financial stress or feeling like you have to get 102 things done, and just like that burden or that exhaustion, unrealistic expectations, just a lot of pressure.
Yeah. Well, it's like if you have family coming over for the holidays, getting the house clean, keeping it clean. If you've got kiddos and dogs and it's like, that's not going to happen. And so being okay with controlling the things that you can control. And if you can't control it, let it go. So one of the things that you can do is make a list. Can I control this? No, then I don't really need to worry about it. Although it bugs me, but I can at least make the list and say, I can't control other people's emotions. I can control my own. I can also protect, and what you're going to go into next, but I can protect how I feel and how I manage and navigate my emotions. And if I need a break, I can say, hey, I need a break. I need to go and rest and reset. I need to put my emotional shawl on so it protects me. And then I'm deciding whether I want to look through a window with a shade, if I want to draw the blinds, or if I want to open the window and have others' emotions flow in and out.
That's so important, because we control that. Like, to your point, we control that. And I think so many times, especially around the holidays, we feel like we don't control that we just have to do all the things all the time for other people. And then our boundaries get super blurred, and now we're exhausted and stressed out. And that's such a great point. That's such a great point. And I think that the holidays also are such a time of overindulgence that it's very easy to then slip into drinking a little bit more, or eating a little bit more, or getting out of your routine where you're not resting as much as you should. But to focus on bringing yourself back to a place where you're not overindulging, and you are taking care of yourself, and you are sleeping, you are resting, you are sticking to your nighttime routine, so that you can allow for your cup to be filled and not just continuously drained, and just recharging yourself, giving yourself the time and the grace to recuperate.
Yeah. And we went into a lot of this deeper in our Thanksgiving episode. So if you missed that, go back and listen for all of those, how to navigate eating through the holidays and all of that. So make sure that you go in with a game plan to protect and provide for yourself emotionally and physically, that you know, hey, I've eaten my protein, I've done all my things, and then I can have a taste it plate. So I can go and taste everything. And I'm okay with that because I gave myself permission, because I
Right.
ate, I had my vitamins, I had my minerals, I had my water today, all the things that you needed to do to set yourself up for success, so that the next day that you don't feel on an emotional, food, or alcohol hangover.
Just dump. Right.
Right.
Exactly.
Because all three of those things together are no fun for anybody, no matter how stable
Yeah.
your mental health is.
Yeah. And saying no, kind of what Anna Kate was saying before, saying no is okay. It's, I, I think so many of us just constantly say yes because we feel like we have to. And then you get in a time of the year where, it's a time of giving and we get caught up in that and we don't feel comfortable saying no. But there are very appropriate times to say no. If it protects you and your boundaries and your mental health or your families,
Right.
say no.
Say no. And it's also okay to say yes and, or yes however.
Right.
So it's not a yes but, it's a yes and. So yes, I can come to your party, and no, that day I'm not available to bring something, but I can bring ice or plates, or I know you really love this dish that I make. If I can get it to you ahead of time and I don't have to bring it, I'm happy to support whatever your event is, but I personally cannot make it during that time. This girl has a busy day, which is why we're also in another studio.
Y'all don't want to hear about it.
But we make it happen, and we do the things, and we plan this days ahead of time to set up for success. It wasn't a last minute thing. If last minute things happen, be okay to say no or say yes and.
Right.
Yes, however, this is the limitation of
your limitation.
Right. And set your own boundaries. And I'd love to go and do that, but right now on my plate, I don't have the attention that I could give to you to go for putting that on my plate. So I'm going to respectfully decline, and that's okay. Especially if you are a yes person and a people pleaser. This is a great thing
to practice.
It's a skill that you have to develop and say, because I know we want to help everybody and do everything and make everybody's dreams come true during the holidays. But if you're burnt out and at that space where you lose your mental stability edge of just navigating all the things, then that's not okay for you or the people around you.
Right. I completely agree. And also, I think kind of the next point is that we get set on what the holiday should look like, right? We get set on our expectations on what it should just present, whether it's to ourselves or to the outside world. And life doesn't happen like that. Like things happen and it doesn't always look like we think that it will. And so just being open to setting new traditions, or instead of holding on to kind of what should have been or what you thought could be or should be, finding and allowing for new traditions to unfold. That can be a really beautiful thing as well.
Hallmark movies, they have hundreds of people that make that happen. You are not hundreds of people.
Yes.
So create the magic, set new traditions. If it's hey, we didn't get the Christmas tree set up ahead of time, then it's, hey, on Christmas Eve, we're going to put all of our family ornaments on because we ran out of time, and that's when we do it. Or we decorate and there's no family ornaments. It's just lights and bows and just normal stuff. And then it's like, hey, this year didn't happen, but it's about the magic.
And it can be fun, right? Yeah. It can be I think some people get so focused on like, okay, we have to do this tradition on this day, and it loses the magic behind it. So sometimes those things pop up and you're like, wait, that was a lot of fun. We laughed, we just spent time as a family. We told good stories. We enjoyed each other's company without the stress of just getting something done because it's a tradition.
Right.
Right.
And don't lose the magic of the holiday of slowing down and spending time with those you love. There's a reason for the season. And if our focus is not on him as the reason, then everything else gets lost.
Yeah, absolutely. And just keep in mind what fulfills you. What brings you joy? What brings you peace? What brings you fulfillment? And then choose to fill your time with those things, instead of things that might drain your energy or, cause conflict or just any sort of negativity. And I think just staying connected to those things that bring you joy can be so positive.
Yep. And you can still have a fulfilling Christmas
season. 100%.
And New Year and Thanksgiving and and Easter's coming up next and all the things. Because all of these family centric things happen, where you're having to go somewhere or provide dinner for a bunch of people or helping clean up or entertain kids or whatever role that you play in the family, like we want to equip you to have the best emotional, mental, and physical support, like with nutrition and those types of things as well, to have the best holidays that you can have. And, families are full of fruits and nuts. And if ifs and buts were candies and nuts, we'd all have a Merry Christmas.
How do you say that? How did you actually just say that? I would have fumbled it, but I think it's so true, because also no one's perfect. Like, there's no perfect here. And we're just trying to offer little tidbits that you can manage, that you can implement in your holiday season, where none of us are perfect, and allow yourself not to be. And that's okay. And it's okay to feel the emotions that you feel, but just know that there are some strategies out there to maybe help you have a little bit better of a day in that holiday season.
Yep. So start with grace and patience, and then how can we find other support?
So in terms of just functional medicine and how I practice, I want people to know that there are other options out there in addition to just conventional medicine. And conventional medicine works wonderful for a lot of people. So please never get me wrong, that's not a knock on conventional medicine. But for other people, they go to whoever they're seeing and they feel a little bit better, but then they just don't quite feel like themselves yet. Right. There's something still missing. There's symptoms that they're still having. They feel a little bit better, but they're not feeling optimal. So those are the type of patients that I get are one of two: patients who are already kind of on medications to help support certain psychiatric things going on, or patients who have struggled with anxiety, depression, OCD-like tendencies, tics, things like that, any type of emotional dysregulation. There are 3 major components that I look at.
Okay.
1 is gut health, 2 are neurotransmitters, and 3 is bacterial and viral loads. So
she's looking at me because I have a bacterial and viral load off the charts.
She's a load of viruses and bacteria.
Load of something.
A lot of things.
Yeah. We did talk about gut health in the last month. So go make sure that you listen to those 8 episodes about really key topics about how to support your estrobolome and your gut.
A word we can now pronounce.
Your pathway. I know. I've been practicing.
It's so true, because there a lot of people know that those microbes influence our digestion or allergies or our metabolism, but they extend so much further, and they do directly impact how we think and how we feel. And that gut-brain axis is just very, very real. It connects us both physically and biochemically in numerous ways. And one of those ways is through the nerves. So these neurons are cells that are found in your brain and your central nervous system that tell you kind of how to behave, how to feel. And there's 100 billion neurons in the human brain. That's a lot. But interestingly enough, your gut houses 500 million of them.
In addition to the 100 billion.
So there's a lot. There's 500 million neurons within your GI tract that are a direct stimulus to your central nervous system.
So moms out there of little kids, especially little kids, but also teenagers, when your teenager is cranky and grumpy and grouchy and not behaviorally the sweet little person that you raised,
know them to be,
check out their diet. Because if they're just having sugar and processed carbs and all the junk that come with the holidays, because they're going and hanging out with their friends, and they come home and they're little heathens.
She chose her words.
And hellions, that they're not your kids. Check out their diet. Make sure that they're getting their vitamins and minerals, and that's all in balance and in check, because this is a big indicator of when it's out of balance. It's going to show up in their attitude, and then it'll show up on their face if they're not eating what they should.
Because the second way that our gut is connected to our brain is literally neurotransmitters. So I tell patients, this is very simplified, but this is how I explain it to patients. There's 2 places we make neurotransmitters. I did air quotes because that's a very in-depth topic. One is the GI tract and one is the central nervous system. Within our GI tract, we actually make things like serotonin, or its baby, which is 5-HIAA. We also make GABA. And so if you have any sort of GI issues going on, those neurotransmitters are not going to be able to send their little signals throughout your central nervous system for you to receive them in the brain like you should. So those direct levels, serotonin, 5-HIAA, GABA, they will be altered if you have any sort of GI dysfunction. Serotonin, for example, it's our feel-good neurotransmitter. And so it helps us to feel happiness and to feel calm and to feel good. And if we have too little of that, insomnia, anxiety, phobias, depression, suicidal ideations, all very, very common.
Yes.
Just from one little guy being off. So then if you go to something like GABA, if you hear her dogs, blame her, not me.
Sorry.
I'm just kidding.
They're sweet babies.
They are sweet babies. GABA is an amino acid that functions as a neurotransmitter in the brain. And it helps to, it's our brain's major off switch.
Yes.
So it helps to modulate all those like good excitatory neurotransmitters.
Okay.
And helps to turn them off. So it brings us down out of that heightened state of fight or flight. So low GABA, when it's too low, again, you're going to have a hard time down regulating those excitatory neurotransmitters. So you're going to stay at that heightened state of fight or flight. You're going to be more anxious. You're going to have more mood swings.
Been there, done that.
Yeah. Your sleep is going to be disrupted. On the flip side, if it's too high, that means that you're turning off your uppers.
Been there too.
Too much. Yes.
Actually, it makes you sleepy.
Yeah, it makes you sleepy. You can't concentrate well. You're fatigued. Your focus is down. So just GI dysbiosis or like overgrowth of the bad bacteria or infections or motility issues or lack of certain kind of building blocks within our GI tract. And like Anna Kate was saying earlier, more of the nitty gritty, you guys can go back and listen to our gut health podcast. But if any of those are off, you can feel that difference in your mood.
Yep.
So I always start with gut health when it comes to patients who come see me.
And then it starts a domino effect, and other things can be dysregulated and start the other things. So what's next?
Next on our list are actual neurotransmitters.
Okay.
So we talked about a couple that you actually make in your GI tract, but we have over, I think the most important part here that people don't realize is we have over 100 neurotransmitters. So when patients get put on conventional medications, let's say like an SSRI, it's addressing just one or two neurotransmitters, serotonin and norepinephrine. Well, we have 98 more. So if that's why some medications, they do a little bit,
right,
but they don't fix the issue completely. You can still feel that anxiety or feel whatever, symptom that puts you on that medication in the first place, because there are so many other neurotransmitters that exist that are out of whack.
But turning off the symptoms does not fix the problem.
Exactly. So after gut health is addressed, then we actually run labs to look. We can't look at all 98, but we can look at a lot of other neurotransmitters within that excitatory and inhibitory neurotransmitter class. So again, the excitatory, they're like on switches of the brain. Inhibitory are like off switches. And even if a patient's on medication, we can do that test while they're on the medication and see where their teeter-totter is imbalanced. Where are you deficient? Where are you in excess? And then bring natural agents to help balance that teeter-totter. So your on and your off switches match.
Yeah.
So you have the appropriate ability to turn your brain off when it needs to be off and turn your brain on when it needs to be on. So that's really cool information because you can do it with or without while you're on or off of medication. Right. The other side of it is just that neurotransmitter test will tell us more about adrenal function. People forget about adrenal function and how it regulates how we feel. But there's norepinephrine and epinephrine are two actual like fight or flight hormones.
Yep.
Our rest and digest and our true adrenaline. And if those are off and I run a neurotransmitter test, well, then I know something's up with the adrenal glands, because 80% of epinephrine is made in the adrenals and 20% of norepinephrine.
Okay.
So if those are both high or low, you're like, whoa, what's going on over there that we need to check out? Because now that's impacting our cortisol, which, yes.
Been there too. If you can't watch us, I'm over here just raising my hand every time she lists something.
And I'm over here continuing to do air quotes that no one can see.
Well, they're watching. Go watch
True,
us.
YouTubers. So cortisol, if it's too high, weight gain is very common, but anxiety, depression, irritability,
Mm-hmm.
and just, feeling that it's a synthetic form of energy is how I like to explain it. Like you
Right.
can feel like you have all this energy, but it's not productive. It's very unproductive energy. And on the low side of cortisol, that's your sluggish and your loss of resiliency and loss of ability to handle stress and to adapt to situations. And I'll have patients gain weight on both sides. Actually, there can be weight fluctuations. Sometimes with high, they'll lose weight unintentionally, but then kind of rebound.
Mm-hmm.
So weight can be a big issue, but just with how we feel, it's that anxiety, loss of resiliency, fatigue, brain fogginess. That's cortisol. So it's like you can have very similar symptoms,
Right.
and they can be from, it can mimic 19 different things. So my first question is, if someone comes with anxiety, is it truly a neurological dysfunction? Is it truly a neurotransmitter dysfunction?
Right.
And I answer that question. But then, this is my crazy brain, even when that occurs, I'm like, okay, well, why? Yes, your neurotransmitters are off. Yes, the chemicals in your brain are off, but why?
Yeah.
What's
happening at the root?
happening? Exactly. The other cool thing that I like to look at are inflammatory markers,
Mm-hmm.
neuroinflammatory markers, because they're an indication of oxidative stress, which is like, everyone knows antioxidants, but they don't really understand what they are, which I think is fascinating because I sure as heck didn't learn that in school. But if
they protect the dents.
Yes, exactly. So when we have things that oxidize our cells or kind of break apart our cells too quickly, we want things like antioxidants to
Mm-hmm.
come in and help repair
Yep.
that cell wall. Now, unfortunately, in our day and age, we are surrounded by things that can damage our cells and create more oxidation. So I like to look at that along with more of the neuroinflammation to get a better picture of what's going on in the patient's body systemically.
Right.
And if there's inflammation, then I want to know why and what it's from. So that brings me to the load of you.
Hello. Welcome to my mess.
Yes, where sometimes all that information, but by now we've gotten our answer. And sometimes it's just a gut health issue. And then sometimes it is truly a kind of neurotransmitter dysfunction. I will say that that's very rare.
Yes.
It's very rare that I find that it's just neurotransmitters being off and there's no reason for it. Like it's hereditary or we're just born this way. Like that's very rare in my world. So if you go a step further and you look at, okay, well, where are the two places neurotransmitters can be inhibited? The gut, we already talked about that, and the central nervous system. So there are certain exposures, whether they are viral loads, bacterial loads, or toxic exposures, that can inhibit how we transmit those neurotransmitters from our central nervous system and kind of send those messages out to receive them at their proper receptors. They have to be received in order for us to feel their effectiveness.
Right.
So if they're being blocked anywhere, whether there are autoantibodies that are creating that blockage, or there's like an immune disruption that is like a little war that's going on, and so those signals can't get through the chain of command there. I feel like I'm just speaking to you as a patient right now.
Okay, so I'm gonna do a timeout and I'm gonna point out something to her. So do you see those 3 binders, those 3-inch binders right there stacked up?
Oh, the blue ones?
Yeah. And then the black one at the bottom.
Uh-huh.
You know what those are?
Your loads?
Yeah, those are binders. Like that one on the shelf that I bring in my Trapper Keeper is just this year. Those are the last 10 years.
Okay, you guys know how she's always saying take notes and stuff? Now I see all her notes and they are 5-inch thick binders times 4.
All my labs, all of the history that when I walked into her office, I didn't bring those 3 binders. I just brought in what she needed. But it's for someone that's chronically ill, having it organized is so important because there are days that I need to go see another doctor or a specialist and they're like, who's your GP? Well, it's now her, but it's like, I don't know. I have 6 specialists. Pick one. Who do you want to talk to? So I just wanted to point that out to you. Of all my viral and bacterial load is stacked up. They're binders like
So
for
I'm
your
not
4
going
inch
to say
binders.
shoot for the stars. I hope that you guys do not have a history like Anna
Don't do
Kate's.
this. Don't.
That's why we call her the
Medical mystery overachiever antibody accumulator.
Yes, because that is actually her. But we're not striving for this. This is Anna Kate's unicorn self.
Yeah. Don't be me when you grow up. Not that part of me, at least.
I was going to say. We won't go there, but that's like smidgen of a part. If we can avoid, then that would be great. We digress. Especially when we're looking at things like autoantibodies in the brain, there's always a reason why. So we have this flip that, the switch that is flipped. I always say flip that is switched.
Flip the switch. Just say it that way.
Switch that is flipped. That's what I always say. I always say it backwards, but then I think about it, and then I end up saying it backwards because I'm thinking about it too much.
Well, Swiss cheese brains over here understood what you were trying to say. So it's
Prego brain.
It's all works.
But I can't really use that because it happens all the time. Anyways, we have this switch that is flipped on whenever we have these autoantibodies going on in the brain and we detect them in the functional medicine world. There's always a reason as to why they have turned on. Our brain doesn't just start attacking itself, or our body just doesn't start attacking itself for no reason. I feel the same way if an ANA is positive. So oftentimes that can come from infections. There's a load of bacteria that those can come from. I'll say the two that I see most readily are Bartonella and strep.
I'm raising two hands because I've had both of them.
Yeah.
And it's not strep throat.
No, it's not. Very important to differentiate, which I'll say in a second. But Bartonella, just very quickly, is a bacteria that's vector-borne. And it likes to hang out in the central nervous system. And so when it does, and our body naturally creates these antibodies to go attack it to defend their host, which is a good thing, then we get all that inflammation within our central nervous system because that's where that war is happening.
Yep.
And so oftentimes then I will get a lot of symptoms from Bartonella, but my top ones are fatigue, anxiety, heightened anxiety, and lower mood. And then a lot of nerve things, weird burning, tingling, vibrating sensations, tinnitus, POTS-like symptoms are very common. But in terms of mental health, anxiety and depression. And I see that so commonly because of that little war going on.
Yep. And there's a fatigue that anxiety doesn't stop, even with the things that I know, because I've experienced this. I've been through this, like right on the front lines of doing the things that, reducing my stress, breathing, taking a bath, getting in the sauna, like grounding, all of the things, making sure I'm hydrated. There's just a fatigue that happens of burnout because that button does not get turned off because of it's in my central nervous system and it's everywhere.
Yeah. And if you don't get rid of it, then you try to do all the things to combat anxiety, traditional anxiety, right? Whether it's medication or whether it's even a natural agent that's meant like ashwagandha or something that's meant 5-HTP, whatever, that's meant to calm down your central nervous system. Oftentimes it just won't work because you're not addressing the reason as to why that anxiety is there in the first place.
So see your functional medicine practitioner or make an appointment with her if you're in a heightened state of anxiety and the things that you're doing are not working, whether medication or supplementation of natural things, because there could be something else that is not just what you're putting the Band-Aid on.
And it's worth just looking.
Yeah.
Like there's no harm in just looking if you have the availability to do so. And especially if you feel like, if you know in your core that something else is there, listen to that. Please listen to that. No matter what a doctor is saying, if they're like, no, your labs look great and your levels look great and this looks great on this medication, if you feel in your core that this is not you or this is not the best version of you, then let's fix that.
Yeah. Fight for yourself. You know your body better than anybody.
Yes.
Nobody knows you better than you.
And trust your instincts on it too. Please. Nobody else in this world can tell you how you feel. Yeah. Nobody. Please listen to yourself. The second one, yes, is strep. And no, it's not strep throat. Oftentimes I won't say it's not strep throat because you can get it from having recurrent tonsillitis, but it's not like active strep throat. Here's an antibiotic and it's gone. Yeah. What I'm referring to is chronic strep, are my strep carriers, are strep infections that don't go away. And she's raising her hand again. And pandas is something that kids are diagnosed with that is a result, it's a neuroinflammation result of that streptococcal infection.
Mm-hmm.
And so we can see things like OCD and tics and emotional dysregulation where this kid is cool, calm, collected, and all of a sudden, yes, quick to trigger and irritable and aggressive and hitting and scratching and screaming and unable to come out of that state. It's uncontrollable. And that is from one little bacteria. And so in that guy, I work to bring that it is possible. Please don't let anyone tell you it's not. It is possible to bring those antibodies down. But what I find is that strep is a follower, that there's something else underlying going on.
They like to party.
They like to party, right? So that allows it to activate, that allows it to take opportunity to then create that neuroinflammation, to then create the OCD, anxiety, tics, behavioral dysfunction. So there's just layers to it. And I don't take like being on an antibiotic for a week and then the kid's good and then it's cyclical again the next month and then you go back on an antibiotic for a week and the kid's good and then it's stuck in that cycle. That's not an answer to me.
Right.
So keep that in mind. Another big one, which you know all about this one too, toxic exposures.
I'm gonna hold my hand up. I'm not gonna put it down this whole section.
Yes, just lay there, hand up. Our toxic exposures, mold toxicity and heavy metal toxicity. Both of them, mold toxicity, I would say I've seen very severe depression from, very severe mood disorders from. Heavy metal toxicity, I've literally had a patient be admitted to an inpatient facility for psychosis, for hallucinating. And it wasn't just one day, it's cyclical. So it presented as a mental health disorder. And it was lead toxicity. You just never know. It's just worth exploring. If you feel in your heart that this is just not you, it is worth exploring other parts of the puzzle piece. And worst case scenario, we just get you to a place where you felt better than you did walking in the door. Best case scenario is we figure out what actually is going on and get rid of it. And now you're not reliant on medications or supplements.
Right. And that's the goal, is improvement, not to fix all and just make everything perfect. And it's just to make progress.
Exactly. And so it doesn't matter to me if patients are on medications or not. It matters to me their goal. If they're on a medication, their goal is to get off of that medication, cool. That is so doable. It is so doable. Doesn't matter the medication. It is so doable where we do it safely, very safely, very slowly. We do the proper testing to wean you down and then help support with natural agents as we're weaning down. So it's not just this cold turkey thing. That is a very viable option. Please know that. Seek out a functional medicine provider if that's something that you want to do. Or it's about optimizing that person while they're on the medication so they don't have to keep going up in dose.
Right.
Or they don't have to switch medications 3 times, and just preventing those incremental increases. Or to wean off depending on what the patient's looking for.
Right. Because your toxic load, there's multiple things to change, right? So the lead could have been from an old house or weird pipes, or, it's in the bath water, it's in the laundry, it's in like dishes, it's in brushing your teeth, it's in the water that you drink. So that over a long period of time, in micro doses,
it bioaccumulates,
can create a problem.
I tell this to my patients all the time, this story, because I think it's such a good one, because so many times patients are like, well, where does lead even come from? Like, we live in a new house. There's no paint, whatever. So I tell this story and it just opens your eyes to how common it is. Ava, probably like 2 years ago. Yes. I was pregnant with Jada and I was redoing Ava's bedroom to like a big girl bedroom. And I ordered a little gold lamp off of, I don't know, some website. I ordered it online and it came and it's this cute little gold lamp and a white shade. And I put it together in her room. I'm like 7 months pregnant at this time. And I start walking away and I look back and on the cord, how sometimes there's like little tags.
Yeah.
So there's 3 of them. And I was like, like that's weird. And I also don't really want 3 on there. It looks ridiculous.
Yeah.
And so I went back to pull them off. And the first one I went to take off, it said, caution, this will expose you to lead. Will expose you to lead. Not may expose you to lead, not can expose you to lead.
Not only expose you to lead if you live in California, but anywhere else you plug it in the country, it's okay.
Right. And I was like,
no.
After I just put it together with my bare hands and pregnant, and I was just like, are you kidding me?
So this is a kid's lamp, right?
This is a kid's lamp, a little mini kid's lamp.
So if it was on their desk, they'd be touching it and moving it around and doing the stuff. It's not like it's just sitting up there, but it emits it because it gets warm and off.
Yeah.
Not off gases.
And I'm not going to say the company that I ordered it from, but it is a very common, I mean, everybody I know orders furniture from there. And so to think of just that one lamp, then your brain needs to go to our devices, our laptops. You know, there's been studies about the trackpad on our MacBooks, LED, all these electronics. Like, it's not impossible. It's not just in paint. You're getting exposure from places, and that's not to make things fearful, but it's just to say that it's real.
Awareness.
Yeah.
And that there are things that you can do to reduce that toxic load and prevent it. Or if you have been exposed, to help take care of moving things through, because you can't really get rid of toxic, like metal.
You can.
Heavy metals.
I mean, I wouldn't suggest doing it on your own, but yes, we do. Like, if there's if there's metal, I was going to say mercury and lead, and then the word metal was in my head. Mercury, lead, aluminum, I find that normal, like, detox modalities don't work. You really, in my opinion, need chelation therapy, which means you need a provider to do that for you safely. So yes, possible, but I think it's more just the general fact that we're all exposed to things all the time,
right?
And how we can't stop that, but how it impacts us and bioaccumulates in our bodies individually are different. And so for some people, that really can result in things that are mimicking or looking like mental health disorders.
Yep.
And so just know that there's so much out there that can be explored outside of, and not, again, go the conventional route, you know, therapy and, you know, counseling and all of that. That is a perfect fit for a lot of people. But if it's not a perfect fit for you, then maybe it's time to seek a different option.
Yep. Have another conversation.
Yeah.
So we've got lots coming your way this month. I am really looking forward to our conversation with Dr. Stephanie, because we're going to talk about burnout, because I've experienced lots of burnout in my life.
Yeah. So. And burnout can look so different. You can have medical burnout. You can have normal life people burnout. You can have job burnout. You can have parent burnout. You can have just, you know, there's so many different facets of it. She is an integrative psychiatrist, which is so rare. Talk about unicorns.
Yeah.
Like, so rare. And I'm so here for it. So we have a great 2-part conversation with her. We have an awesome 2-part conversation with a 2-time Olympic gold medalist, just to get her thoughts on, and kind of her background on what it was like being an Olympic athlete at the age of 16. And then kind of move forward in being thrown into mom life. So we have some really cool episodes coming up that we're excited to share with y'all.
We are very, very excited. So we have a request for y'all. If y'all are listening to this, we are getting her ready for new baby to come. So we are not going to stop recording, but we are going to record short or mini episodes of specific topics. So if you have a topic that you would like us to cover during that period, so maybe you have specific questions on mold, because that's like an 8-hour conversation just there. So if you have something specific, ask us about that. Anything that you would, you know, what's a good swap, or things that need to happen in the new year, or whatever they are. And we know that you have all of the burning questions. So let us know, and we will tag that and put that in and make a mini episode of that. So when she is on new mommy duty, and spending time with her family, and we want to give her that break, you'll still have access to me, and we'll post those and all of the things.
And we mean anything. Yeah. Anything in the world of functional medicine, of health and wellness, of non-toxic living, literally anything.
Yeah.
We are open books. We are here to answer for you. And we're super excited about them. I think it'll be a great, cool little change of pace and little snippets. So yeah, please let us know what y'all are needing help with, or guidance, or, you know, just curious about.
Yeah. And I will try to do something along the lines of the binders and let y'all know what that looks like in our community.
Yes. So y'all stay tuned for the rest of our month of mental health.
Yes.
And until we see y'all again, let's
discover together.
We hope you've enjoyed this journey of exploration and learning as much as we have. Before you go, we have a special request for you, our beloved discoverers. We'd be thrilled if you could show your support in a few easy steps. Step 1, if you're watching on YouTube, please hit that like button and subscribe to our channel. Don't forget to ring that notification bell so you never miss a moment of discovery. Step 2, if you're listening via Apple Podcasts, please take a moment to rate and review our show. Your feedback means the world to us and helps others discover our podcast too. Step 3, whether you're on YouTube or listening on your favorite podcast platform, please share the Discovery Doc podcast with your friends, family, and social networks. It's the best way to spread the joy of discovery. And finally, don't forget to follow us on social media. You can find us on Instagram, Facebook, and TikTok at The Discovery Doc. Stay connected with us for updates, behind-the-scenes content, and so much more. Plus, for exclusive content and additional resources, be sure to check out our website at www.thediscoverydoc.com. And while you're there, if you have a burning question or a topic you'd like us to discuss on the show, simply let us know. Thank you, Discoverers, for being part of our incredible journey. Until next time, let's discover together.
The content provided in this podcast provides general information and discussions on various topics related to health, wellness, and medical advancements. However, it is essential to understand that the content provided in this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. The hosts, guests, and contributors are individuals sharing their personal experiences, opinions, and knowledge in their respective fields. While they strive to provide accurate, up-to-date information, medical knowledge is constantly evolving, and the information presented in this podcast may not always reflect the most current research and medical guidelines. It is crucial to consult with a qualified healthcare professional or medical expert for specific medical concerns. Never disregard professional medical advice or delay seeking medical treatment based on the information presented in this podcast. The Discovery Doc podcast encourages listeners to use their own judgment and discretion while implementing any suggestions, recommendations, or lifestyle changes discussed in this episode. Each individual's medical situation is unique and may work for one, may not be suitable or safe for another. The podcast hosts, guests, and contributors are not liable for any direct, indirect, consequential, or incidental damages or harm that may arise from listening or acting upon the information provided in this podcast. Listeners are responsible for their own health decisions and should exercise caution and seek professional guidance when necessary. By listening to this podcast, you acknowledge that you have read, understood, and agreed to this medical disclaimer. If you have any questions or concerns about this medical disclaimer, please consult a qualified healthcare professional.